Imagine a single-celled parasite living in your intestines, causing a disease that could potentially be fatal. Sounds scary, right? Welcome to the world of amoebiasis. This disease is caused by a protozoan parasite known as Entamoeba histolytica. It moves around by a jelly-like, tongue-like protrusion of its body, known as a pseudopodium. Interestingly, amoebiasis predominantly affects children living in cold areas. So how does this parasite make itself at home in our bodies? Let's find out. Once the parasite enters our system, it doesn't just sit idle. It wreaks havoc in its own microscopic way. The symptoms of amoebiasis can be pretty wide-ranging. Some individuals might experience abdominal pain, a sign that the invader is disrupting the normal functioning of the digestive system. For others, the first warning sign could be bloody diarrhea, a clear indication of the parasite's destructive tendencies. Weight loss is another common symptom, as the body struggles to absorb nutrients from food due to the infection. In more severe cases, amoebiasis can lead to liver abscesses, where the parasite causes pockets of pus to form in the liver. In the worst-case scenario, these symptoms can be fatal. Dr. Jane Doe, a leading gastroenterologist, warns that the impact of these symptoms on overall health can be significant, leading to severe dehydration, malnutrition, and in rare cases, even death. But how do we know if it's amoebiasis causing these symptoms? What are the diagnostic measures? Diagnosing amoebiasis might not be as simple as taking a temperature, but it's certainly achievable. When suspecting an infection, doctors often look for trophozoites, a developmental stage of the parasite, in fluid feces. Alternatively, they may also examine fecal samples for the presence of cysts, a dormant and hardy form of the parasite. This detection process is crucial as it allows for a prompt and accurate diagnosis, setting the stage for effective treatment. Speaking of treatment, there is a range of medications available to combat amoebiasis. Metronidazole, a potent antimicrobial, is often the first line of defense. In some cases, chloroquine sulfate, traditionally used against malaria, may also be employed. As a last resort, doctors might prescribe antibiotics like erythromycin. These treatments, while effective, are not without their side effects, and should be administered under the careful supervision of a medical professional. Treatment is available, but prevention is better than cure, right? So how do we prevent amoebiasis? Preventing amoebiasis is largely in our hands, and it starts with understanding the route of transmission. Education is our first line of defense. Knowing how this disease spreads empowers us to take preventative measures. Adequate sanitation, another key factor, helps us keep our environment clean and safe. Lastly, protecting our food and water from pollution and contamination is essential in keeping this disease at bay. Now that you know about amoebiasis, its impact on health, diagnosis, treatment, and prevention, what steps will you take to ensure you and your loved ones stay safe? Remember, knowledge is the first step towards prevention.